Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Arif Ali of Peeples Cancer Institute in Dalton, Georgia. First off, thank you so much for joining us today, Dr. Ali.
Thanks for having me. I'm glad to be here.
I'm glad you are. Dr. Ali is a board-certified radiation oncologist at Peeples Cancer Institute at 1215 Memorial Drive on the campus of Hamilton Medical Center in Dalton, Georgia. Dr. Ali, the first question I have is, why did you choose to become a radiation oncologist?
So I tell you, I had a very unusual and weird path to medicine in general, and especially radiation oncology. So I actually did, I didn't quite know what I wanted to be when I grew up, and so majored in engineering.
In engineering?
Yeah, as an undergrad.
Is that right?
Yeah, and then I ended up doing a master's in engineering, and I went to work at a completely unrelated to medicine. Went to work at a laboratory called Los Alamos National Laboratory, working on, believe it or not, explosives.
Yeah, I was going to say that there's a lot of things that go on there that are very confidential, very secret government stuff, I understand.
It's a government lab. All the stuff that I did, they didn't let me do anything like that. All the stuff that I did was open publication, and it was for academic purposes. But my master's thesis was high explosive ignition dynamics. Believe it or not. And so I went from there, and I actually worked there as a staff member for a while, just kind of doing more unusual things, and decided that, medicine was really of interest. It was fun being out there in the mountains. I did stuff that like every 5-year-old boy dreams of doing. You go out and, essentially do things with fireworks and explosives and kind of get paid for it.
Wow.
So it was a good deal.
It would be hard for me to walk away from that.
Yeah, no, it was. It was like, I'm like, geez, this is, you could do this for forever. But eventually I think you kind of reach the point where, you're looking for more fulfillment, I guess, more reward, and a lot of that comes from, I think what I was doing was great. I had a lot of fun doing it, and the folks that are working there are doing wonderful things for our country. But for me, I just kind of wanted more personal interaction. Wanted to talk with people, want to be part of their lives, help people, that sort of thing. So that led me to medical school. And then radiation oncology was kind of a process of exclusion for me.
So you tried other things first?
Yeah, so the nice thing in medical school is you kind of rotate through various specialties and kind of check stuff off. And it eventually came down to 2 specialties. It came between radiation oncology and orthopedic surgery. And when I looked at it, it's like, radiation oncology is, in my opinion, probably the most advanced specialty in medicine that there is right now. The equipment that we use, the technology that we use is like, it's like next generation. This is like Star Trek type stuff. I'm like, that'd be a great fit with my background. The other part about it is with cancer patients, this is a time in their life when there's a lot of need. There's a time in their life when perhaps more than any other time in the world, it's like life flashes before your eyes. You start thinking about.
Well, you get the C words, you get the cancer word.
Exactly, and it's a shock.
And everyone is afraid of that.
Yeah, and so this is really, for many people, this is a pivotal moment in their life. So it's really just a kind of a privilege to be part of that.
I'm sure that it is. Speaking of technology, how much has that technology changed in the last 10 or 15 years?
So for a lot of specialties, there hasn't been much change in, there's drugs. Drugs are always changing. Medications are always changing. They're always coming out with new sort of medications. But with radiation oncology, there's been like massive change just within the last 10 years, 15 years. So
the technology, you're talking about the equipment that you use every day?
Yeah. So
a lot of it computer controlled, I'm sure.
All of it.
All of it
is completely computer controlled.
Well, tell me about that pinpoint accuracy. You have that now.
Well, so that's the new technology. So nowadays, unlike 90s or 80s or that sort of thing, we're able to use something called volumetric modulated arc therapy, VMAT, or some other fancy terms for it, things called stereotactic radiosurgery, stereotactic body radiotherapy, all these sorts of fancy acronyms. And basically, what's going on is we're able to create like highly customized radiation fields for a tumor. So tumors are never perfectly spherical. They're never the same shape. And so we can design these radiation fields to fit that tumor like a custom fit glove.
Now, what's your favorite part of your job that you can think of?
Yeah. So, so I talk about the technology a lot, and I'll definitely love it. And being an engineer, it's like I really, I understand it, or at least some of it. And that's sort of what excites me. But to be honest with you, the best part about my job is is seeing patients. So, there's nothing like patient comes in, they're scared, rightfully they're worried, but this is a life-threatening illness. And you can help them through that process. You hold their hand. You can comfort them during the process. You get them through the radiation. You bring them in for follow-up, and you get to tell them the good news, like, hey, it's gone. We don't see anything. And so just kind of being part of all that is it's really unbelievable.
It sounds like it's very exciting work.
No, it is. I love my job.
We're going to take a quick break. When we come back, we're going to talk about Peeples Cancer Institute in just a moment. Stay here.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life.
Welcome back to Health for Life. Today we're talking with Dr. Arif Ali from Peeples Cancer Institute in Dalton. Dr. Ali, many of us have seen pictures of the Peeples Cancer Institute, but we haven't seen the amazing technology and staff inside. Can you tell us more about Peeples Cancer Institute?
Yeah, no, I'd definitely be happy to. So the Peeples Cancer Institute, is part of Hamilton Medical Center, opened just about a year ago now. Good. This is a game-changing facility in my opinion for this region. So the way that we were set up before the Peeples Cancer Institute is there's the Judd Radiation Cancer Center or department. Basically, it's basically just radiation oncology that was attached to the hospital, and so patients wanted to get a mammogram, they had to go down, on the other side of the hospital, or Hamilton Diagnostics. There's an infusion center. Things were very sort of scattered.
Now, were you a part of that before?
I was, yeah. So
how long have you been with Hamilton?
Since 2017. So I've been here.
You've been there
a
a
while.
Okay,
yeah.
good. So when you started, they did not have Peeples Cancer Institute.
Yeah, so we were over at the hospital. It was a nice area, but it was small. Peeples Cancer Institute, it's a one-stop shop for radiation oncology is a large part of that. Some of the medical oncologists are upstairs. They have an infusion center upstairs. It's just it's nice to have all of that in one location. The facility is gorgeous. The kind of equipment that we have available to us is state of the art. It's all encompassing. 99% of patients we're going to be able to treat right here. We're going to be able to keep right at the hospital, which is nice. It's good for patients.
Well, what about the staff? Tell me about the staff.
Fantastic. Hands down, every time we ask patients after they get done with the radiation, the staff is the number one reason why they'll come back and why they enjoy being there. It's nice to have a new building. It's nice to have plenty of parking spaces and brand new couches and everything else. But really, it comes down to the staff.
Let's take a short break. When we return, we're going to talk about radiation therapy on Health for Life.
Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. Today, talking with Dr. Ali from Peeples Cancer Institute in Dalton. We've been talking about radiation therapy. When is radiation therapy typically used?
For some types of cancers, a patient might get surgery, then radiation, then chemotherapy. For other types of cancer, we may only do chemotherapy. For yet other types of cancers, we may only do radiation. So, some cancers might only get surgery. So it's sort of one component of
many.
Of many, exactly.
Dr. Ali, if I had to have radiation therapy, what is that process like?
Yeah, so the first thing that would happen would be a consultation with radiation oncology at the Peeples Cancer Institute. It's either myself or Dr. Gallinopoulos. You'd see one of us. We'd kind of bring you in. We'd pull up some the images. We would review imaging. We would review sort of everything that's happened so far. Talk about treatment options, and sometimes the best option may not be any treatment at all at that point. It may just be observation, but many times we do opt to deliver radiation. But so that all happens at the consultation. We basically make a decision to proceed with radiation or not. Once the decision's made to proceed with radiation, we schedule a patient for something called a CT simulation. So that's just kind of it's just a regular CT scanner, but that's in our department. But that CT scanner is able to interface with the treatment machine and our planning equipment. And so what happens is we do a scan, a CT simulation. It creates basically a three-dimensional representation of the patient's anatomy and the tumor inside our computer system. And so in the computer, we have sort of a virtual model of a patient's body and the tumor, and we kind of move it around and steer the beams and design the radiation field. We plan it all out inside of a computer before we do it in real life. And
You're kidding me.
Yeah, so it's all, that's
Is
what I mean by
right?
It's all computerized. It's all virtual. And that allows us, again, to deliver precise doses of radiation. We can try this angle. It's like, oh, that didn't work. So all the trial and error is inside the computer. And that planning process takes about a week. We have the radiation oncologist is involved. We have a physicist, master's level or even a PhD level physicist. We have a dosimetrist, which is a specialist that works on planning the beams and designing the doses and creating the plan. There's double checks. For some types of treatments, the physicist will actually deliver the radiation to a mannequin, what's called a phantom, if you will, but essentially it's a mannequin, it's a fake person, to make sure that the machine is delivering the exact radiation plan that's meant for the patient. And when all of that quality assurance is done, then the physician signs off on it and gives a thumbs up and ready to treat the patient. So the patient will come in on the first day. The therapists, they're the ones that the patients see every day. The therapists, radiation therapists, will put the patient on the table. They'll do some imaging, make sure the patient's lined up perfectly. Call the physician in to just kind of verify, double check, triple check. When everyone's good, we'll sign off on it, and the machine takes over and delivers the radiation dose.
That is fascinating.
Yeah, so it's great stuff, but it works really well, and we're thankful to be able to have this sort of technology available to us.
I know prostate cancer. A lot of people are concerned about prostate cancer. How is prostate cancer treated?
So prostate cancer is an interesting sort of cancer. It's actually very common. About 1 in 9 men will end up getting prostate cancer in their life. It generally occurs for older folks, older men, maybe about the average age, probably about 66 or so. It's an interesting cancer in that most men, assuming it's appropriately treated, don't actually die from it. Occasionally there are the men that will have sort of very aggressive prostate cancer, but not usually. Lots of great information. Thank you, Dr. Ali. We'll be right back on Health for Life.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life.
Welcome back to Health for Life. Today we're talking with Dr. Ali from the Peeples Cancer Institute in Dalton. Nowadays, COVID-19's on everybody's mind. Let's talk about COVID-19 when it comes to Peeples Cancer Institute in Dalton and some of the precautions that you guys take to keep from spreading COVID-19.
We have a lot of precautions that we're taking over in radiation oncology and in the Peeples Cancer Institute. We follow the CDC guidelines to the letter, as far as precautions. I mean, patients are screened, staff are screened. We're looking for making sure no one has an elevated temperature. Everyone's wearing masks.
So if you feel like you need to visit the Peeples Cancer Institute in Dalton, don't let COVID scare you away.
Yeah, cancer is one of those things where I would hate for patients to forego treatment for their cancer because they're worried about coronavirus. I mean, when you balance it all out, that cancer is a life-threatening, for most patients, a life-threatening diagnosis that a patient has. So we do need to treat that regardless of anything. But at the same time, we're taking all the precautions. We really go to extreme lengths to make sure that patients are not put at risk and that staff isn't put at risk as well.
Dr. Ali, thank you so much for being our guest today from the Peeples Cancer Institute in Dalton. For more information or an appointment at Peeples Cancer Institute, call 844-PCI-HOPE. That's 844-PCI-HOPE. To make an appointment for a 3D mammogram, call 706-272-6565. And to learn more about the Peeples Cancer Institute, visit hamiltonhealth.com/cancer.
Did you know that colon cancer claims over 50,000 lives each year? The good news is that colonoscopies save lives. Convenient appointments are available at Hamilton Medical Center's new Bandy Endoscopy Center, located at the corner of Broderick and Memorial Drives. Hamilton follows CDC guidelines and screens for COVID-19 symptoms at the door. If you are age 50 or older or have a family history of colon cancer, ask your primary care provider to schedule your colonoscopy. Please don't delay important medical screenings. Your health won't wait. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life. If you are sick with COVID-19 or think you might have it, take steps to help protect other people from getting sick. For more information, visit hamiltonhealth.com or cdc.gov. Right care, right time, right at home. Hamilton Physician Group now offers telehealth appointments through your mobile phone, tablet, or computer. Connect with your healthcare provider in the comfort of your own home. Call any Hamilton Physician Group office or visit hamiltonhealth.com/telehealth to schedule your appointment. Most health insurance plans are accepted and self-pay options are available. Hamilton Physician Group. We're here for you.
Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.